So before entering the room, I'm going to review the client's electronic medical record. I'm also going to check outside the room for any signs, precautions, and flags. I'll perform some hand hygiene.
Hello.
Hi, my name is Amy,
Hi.
and I will be your nurse today.
Hello.
Can you state your full name and date of birth for me?
Joey Davidson, 07/11/1995.
Thank you. Right, I'm going to conduct a general survey. I'm looking at his general appearance. His hygiene looks good. Grooming looks good. Skin color, skin integrity looks good. Facial features are symmetrical and there is no sign of distress. I am also going to assess his level of consciousness and whether he is alert and oriented to person, place, and time. Joey, do you know what location you're at today?
Hospital.
And do you know what month it is?
October.
Good. Client is alert and oriented to person, place, and time. I've also already collected vital signs beforehand and they're documented in the electronic medical record. Okay, so Joey, what's the reason you came in here today?
To get a head and toe assessment?
Yes, I'll be conducting a head-to-toe assessment. That just means I'll be assessing your entire body, starting from your head down to your toes.
Okay.
So I'm going to begin by inspecting his head, face, eyes, nose, mouth, and ears. I am looking at the overall skin color, looking if his facial features are symmetrical. I'm also looking for any drainage, lesions, or swelling. Everything looks good. Okay, I'm gonna have you sit up for me, okay, Johnny? Okay. I'm gonna start by assessing his cranial nerves, starting with cranial nerve 2, optic, cranial nerve 3, ocular motor, cranial nerve 4, trochlear, and cranial nerve 6, abducens. All right, Joey, so I'm gonna ask you to look at my shoulder. I'm gonna shine a light into your eye, okay? Okay, so now can I have you look at the pen light? And then can I have you look at the wall? Can you look at the pen light again? And then look at the wall. Good. Pupils are PERLA, which stands for pupils are equal, round, and reactive to light and accommodation. All right, now I'm gonna have you follow this pen light with just your eyes, don't move your head. Good, all right. Next, I will be inspecting his nose. I'm going to look into each nostril. I'm checking for any drainage. I'm now going to assess cranial nerve 1, olfactory. Can I have you close your eyes for me? All right. And what do you smell?
Coffee.
Good. Okay. Now I'm going to inspect his ears. I'm going to palpate his pinna, his tragus, and the mastoid process. I'm going to look for any drainage. Everything looks good. Okay, now I'll be assessing cranial nerve 8, vestibular cochlear. Right, I'm going to have you close your eyes again. And can you tell me which direction, left or right, you hear the rubbing of my fingers?
Left. Right.
Good. Right. Next, I will be assessing cranial nerve 5, trigeminal, and cranial nerve 7, facial. Okay, I'm gonna have you close your eyes again and tell me where you feel the pen light on your face.
Forehead. Right cheek. Left cheek. Chin.
Good. Can you open your eyes? Can I have you puff out your cheeks for me? Okay. Can I have you smile for me?
Smile.
Mm-hmm. Can I have you frown? Good. And then can I have you raise your eyebrows? Good. All right. Now I'm going to inspect his neck. I'm checking to see if the trachea is midline. Can you move your head to your right side for me? All right. I'm going to check for any venous distension, jugular venous distension. Looks good. All right, I'm going to palpate for a carotid pulse. Looks good. All right, now I'm going to assess for cranial nerve 7, facial, cranial nerve 9, glossopharyngeal, cranial nerve 10, vagus, and cranial nerve 11, hypoglossal. Right? Can I have you open your mouth and say ah for me? Stick out your tongue. Good. All right, can I have you swallow? And then say light, tight, dynamite.
Light, tight, dynamite.
All right, next I'm going to assess cranial nerve 11, accessory. Joey, I'm going to have you press your face against my hand. All right, try to resist it. Okay, can you do it the other direction? Okay, and now can you shrug your shoulders against my hand? Good. All right, now I'm going to move on to assess the anterior part of the chest. I have a couple of questions for you, Joey. Are you experiencing any chest pain right now?
No.
Experiencing any shortness of breath?
No.
Do you have a history of any respiratory diseases like asthma?
No.
Do you have any history of cardiac disease?
No.
Do you use a device like an incentive spirometer to help you breathe?
No.
See that he is not using any O2 right now. Have you had a recent cough lately?
No.
Are you experiencing any dizziness?
Mm.
So now I'm going to just inspect your chest. I'm going to need you to take off your shirt for me.
Okay.
So I'm just looking at the expansion of his chest and if it's symmetrical and the movement of his breathing. I'm also looking if he has the effort of his breathing too. Everything looks good. All right, Joey, so I'm just going to go ahead and listen to your lungs. And I'm going to ask that you breathe in and out every time you feel the stethoscope against your chest. So, above the clavicle, first intercostal space. Mid-clavicular line, second intercostal space. Clavicular line, second intercostal space. Mid-clavicular line, fourth intercostal space. Clavicular line, sixth intercostal space. Anterior axillary line, eighth intercostal space. Okay. Now I'm going to listen to your heart. Okay, I'm going to start with right sternal border, second intercostal space, aortic valve. Left sternal border, second intercostal space, pulmonic valve. Left sternal border, third intercostal space, Erb's point. Fourth intercostal space, tricuspid valve. And mid-clavicular line, fifth intercostal space, mitral valve. Going to listen to all the areas of your heart again, but this time using the bell side of my stethoscope. All right, so now I'm going to assess your upper extremity. Just going to feel with the back of my hand the temperature. Okay. I'm also going to inspect and look at skin color, if there's any edema. Everything looks good. I'm going to ask you to close your eyes again, Joey. And tell me where you feel this pen light on your upper extremities.
Right arm, bicep. Right hand. Left bicep. Left hand.
Good. Alright. Now I'm going to test for strength. Can I have you push your arm against my hands? Good. And this one? Alright. And then can I have you grasp my hands for me? Right here. And just squeeze them. Good. Alright. I'm going to test for coordination and have you touch your thumb and your finger, each finger together. Good. Alright. Now I'm going to check for capillary refill bilaterally. I'm going to palpate for radial pulse bilaterally. Okay. Everything looks good. Right, now I'm going to assess your abdomen. I'm going to have you lay back on the bed. Okay. Now I have a couple of questions for you relating to your abdomen. Are you having normal bowel movements?
Yes.
Are you experiencing any diarrhea?
No.
Experiencing any constipation?
No.
Experiencing any vomiting or nausea?
No.
Are you experiencing any abdominal pain?
No.
Just going to listen to your abdomen. I'm going to start with the right lower quadrant first. Right upper quadrant. Left upper quadrant. Left lower quadrant. Now I'm going to assess for rebounding tenderness. It's going to ask you if you feel any pain as my hand releases.
No.
Good. All right. Now I'm going to assess your urinary system. I have a few questions for you. Are you experiencing any issues with urination?
No.
Experiencing any urgency?
No.
Are you experiencing any pain?
No.
So I'm going to check if you have a Foley catheter. He does not. I'm going to now palpate the bladder and then inspect your perineal area. Right, now I'm going to assess your lower extremities. Have you close your eyes again and tell me where you feel the pen light.
Right thigh. Right foot. Left foot. Left thigh.
Good. I'm also inspecting for color and hair distribution and any pitting edema. He does not have any of those issues. Right, can I have you raise your leg against my hands? Good. Other leg. Right, can I have you arch your foot against my hand? Okay. Other foot. And can I have you push in the other direction? Other foot. Good. Great. I'm going to get a capillary refill. Good. And I'm going to check for pedal pulse bilaterally. And check for the capillary refill bilaterally. Alright, Joey, now I'm going to have you sit on the edge of the bed again. Okay, now I'm going to listen to your lungs from your back, from behind. Okay. Right, and then once again, breathe in and out every time you feel my stethoscope. Second intercostal space. Oh, can I have you cross your arms in front of you? Okay. Can you breathe in and out? Second intercostal space. Fourth intercostal space. Sixth intercostal space. Eighth intercostal space. Good. Okay. Now I'm going to test the symmetry of your lung expansion. Can I just have you take a deep breath in and out for me? Okay, I just have my hands spread across your back. Everything looks symmetrical. Right. Now I'm going to test your balance. I'm going to have you stand up for me. I'm going to conduct a Romberg test. Right. Can I have you close your eyes? Good. All right. Now I'm going to test for coordination. Just going to have you step towards me from heel to toe. 3 steps. Good. All right, so we're all done with the head to toe assessment. You can sit back in bed. Do you have any questions for me?
No.
Okay. All right, so I'm just gonna make sure your call light is next to you, within reach, and if you need anything else, don't hesitate to use it.
Okay.
Okay.
Thank you.
Going to perform. You're welcome. I'm gonna perform some hand hygiene. Okay, and then document the results of my assessment in the electronic medical record.